All right, on to the latest in coronavirus. Dr. Anthony Fauci is now warning of a surge upon a surge in cases after a surge in travel this holiday weekend. But at least 2 vaccines could be right around the corner. Infectious disease specialist and ABC contributor Dr. Todd Ellerin is here now to break it all down for us. Dr. Ellerin, welcome back. You know, we heard the warning from Dr. Fauci. When will we know if Thanksgiving did create a surge upon a surge, as he puts it? And is there anything we can do at this point to stop that?
Right. So, the bottom line is it's going to be a couple of weeks before we know. The incubation period's about 5 to 7 days. And then for patients to get hospitalized, the more severe cases, another week after that. And then reporting, there's always a delay. So it'll be probably about 2 to 4 weeks before we know. But the answer is we really already know, because with all of this mobility, and there was a lot of travel, as we've heard, there is going to be another surge. It's just a question of how high and how bad does this get. And again, we have 2 major holidays back to back, and we're really sort of rereading the same book. After all of these holidays, we have had surges. So I'm afraid that we really have to buckle down now, and we have to have our sights on beyond Christmas. So masking now and distancing and limiting the crowds and ventilation indoors, all of that is not really going to protect us over the next few weeks, but it's what happens after that.
Is there anything that we were doing going into this sort of holiday season that you think, particularly for the next few weeks until Christmas, that even that we should cut out of our behavior?
Yeah, it's so difficult because these holidays, Thanksgiving, Christmas, these are all about bringing people together. And right now, that is a direct recipe for viral transmission. So we have to limit the amount of travel and try to just, we need to make it to these vaccines. I don't want to think about the second half of this pandemic, when we know that help is around the corner, to think that people are going to succumb to this virus because of holidays and people coming together. So, we know what we have to do, but it's very challenging.
So let's
talk about days ahead.
Well, I heard you saying there are dark days ahead, and I'm sorry to interrupt, but let's talk about the brighter days ahead, maybe, where we know this vaccine, you said, is right around the corner. Moderna is asking today for emergency use authorization from the FDA for its vaccine. Pfizer started that process 10 days ago for its vaccine. And the head of the HHS said that he expects shots in people's arms by Christmas. So what do you think about the pace of that?
This is an amazing pace. This is the right pace. Think about this. 15,000 patients in the Moderna trial received vaccine. Only 11 of them acquired disease, compared to 185 in the placebo group. That is incredible efficacy. We've heard no issues about safety. Very soon, the FDA is going to rule and allow an indication. We heard that tomorrow the CDC is going to come up with recommendations, and ultimately, we're going to hear that these vaccines are being shipped to the states, and the states will distribute it based on the guidance that the CDC and the FDA have harmonized together. And remember, we're good at giving vaccines. We know how to do this. We do it for influenza. We give hundreds of millions of doses of influenza vaccines every year. So we are going to rise to the challenge, even though this is a Herculean task.
And on implementing the vaccine, Secretary Azar also said that the governors will be the, quote, air traffic controllers in charge of getting this to people, not the president and not industry leaders. So do you think that's the best approach?
Remember, here's an example. And this is just an example because we don't know what people are going to say, but the FDA could say the COVID-19 vaccine is indicated for patients 18 and older so far. I think the kids will come later, but we'll see. And then what happens is they give their priority groups. And what the CDC says is we recommend the vaccine in these targeted phases. Okay, so the first phase, the patients in chronic care facilities and congregate settings, the healthcare workers, followed by, patients with chronic medical conditions, the elderly, et cetera, and then going down from there. So those two recommendations will be harmonized, and then ultimately the states will follow that practice. Yes, I do believe that the governors and their advisory committees are going to be able to, distribute appropriately. That's what they do for other vaccines. Remember, the government can't really control this on a national level. We need communities and the pharmacies and hospitals and medical clinics to be able to give it to the patients that we see fit. And that's obviously going to be based on the CDC and the FDA guidance.
All right. It does feel like we are just so close. Dr. Ellerin, thank you as always for your advice.
Yeah.
Holding out hope with you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.